Good evening, everyone, and welcome to the 2023 Faces of Faith. We are honoring 9 local people this year who are cancer survivors, and we're going to have a community conversation about cancer prevention and survivorship. We hope that this will inspire and educate and uplift anyone who is experiencing anything similar to this. My name is Kimothy Jones, and I'm the Program Director in the Office of Public Health at Baystate Health. So welcome. And at this time, I'd like to invite Reverend Marcus McCullough to open us up in prayer.
Good evening, all. As we prepare for our program tonight and we prepare to pray and give thanks, first want to pause for a moment of silence in acknowledgement of all of those who have fought this fight, but for whatever reason are not with us. So I'm going to invite us for just a moment to silently reflect upon those who have gone before us. And now, join me in a spirit of prayer. Great One who moves among us, we ask your blessing upon this special event and this special moment. We give thanks for the courage that you have given these honorees and so many others to deal with one of the most difficult challenges we know. We ask that you would smile upon us in this moment and allow us to learn even from them how to be courageous, how to learn from each other, and how to lean upon our faith. We ask that this moment would inspire not only us, but someone who may be watching to know that they can do it, to know that they can make it, to know that they are never alone. Help us always to be mindful that you are with us, and that with faith, nothing is impossible. We pray your blessing through every holy name. Amen.
Thank you, Reverend McCullough. And now I would like to introduce my supervisor, Frank Robinson, Dr. Frank Robinson, Vice President of the Office of Public Health at Baystate Health.
Thank you, Timothy. This is our second annual Faces of Faith event. Great turnout, fantastic event again. Thanks to Timothy. I just sort of stood in the background and watched her work. I said, "Go, girl, you got it. I got your back." So I tried not to get up here at all. I wasn't even on the program, but she twisted my arm and said, "Well, you have to at least come up and introduce your new boss." Yeah. And I said, "Okay, well, given that command, I'm up here to provide a introduction to my new boss." Okay. And my new boss is sitting right there, right. Dr. Tian Hinson. So I'm going to give you a little bit of her bio, tell you where she's come from, and she might tell you a little about where she's going in her own remarks. So Dr. Hinson comes to us as a consequence of a national search. We looked all over the nation and found out she was down the street in Boston. Wow. And we found out not only was she down the street in Boston, but she'd already worked at Baystate once in her previous journey. And so we brought her back home, so to speak. So Dr. Hinson will serve on our senior leadership team. We call it the President's Cabinet, where she reports up to our CEO and President, Dr. Mark Kerouac. And so it's a unique and special place for the role that she has taken on as Senior Vice President for Diversity, Equity, and Inclusion. Now, in the old days, that position was somewhere tucked down in the organization, but because of the critical issues around health equity that have come to the front as a consequence, or I should say, not as a consequence, but exaggerated by COVID, health equity, diversity, inclusion has sort of risen to the top. And so Dr. Hinson sits in the right spot, right place, right time for challenges that face our community. So let me tell you about her a little bit more. More than 20 years of experience in diversity, equity, and inclusion, and she brings with her a deep competency, content matter expert as a clinician. And you'll hear a little bit more about that in a second. So she's no stranger to Baystate. I told you she's being recycled. She was here once before in 2001, where she was a nurse manager and then served as a special project coordinator. I think she ran the NICU. Yeah, so she was with us a long time ago, when you think about it, 2001. In a new role, Dr. Hinson will be responsible for leading efforts to promote diversity, equity, and inclusion throughout Baystate in a proactive fashion. So not reactionary, but proactive, sort of creating change and building systems that deliver on health equity, on diversity and inclusion. So she's not a stranger to this work. I think she brought that, is bringing a portfolio from her role as Boston's Children's Senior Director of Nursing and Patient Care Operations for Diversity Initiatives. And she was involved in workforce advancement, mentorship, recruitment, retention, professional development of 3,000 registered nurses. Again, just a glimpse of her experience. She's a graduate of the Mass General Hospital's Disparity Solution Leadership Program. So she's a fellow and has had some special attention to developing her competencies in this space. So I mentioned that prior to Boston, she passed through Baystate, 2001. And previously that, she worked at Children's Hospital of Philadelphia in a senior nursing role, also directing a neonatal nursing practice, led international global health nursing initiatives, partnered with several leaders to create a wide range of clinical and diverse EDI, equity, diversity, and inclusion initiatives. Bachelor's in Nursing degree from Syracuse University, Master's in Science, nursing degree with a focus on healthcare administration from Villanova University, Doctor of Public Health degree from the University of North Carolina at Chapel Hill. And she's also a nursing executive board certified from American Nurses Credentialing Center, and on and on and on and on. So I'm going to stop there. And note that Springfield is pleased to welcome Dr. Hinson, as is Baystate Health. And we have big things in store for us, our organization, and our community under Dr. Hinson's leadership. So I invite you to stand up and applaud and yell and scream as she takes the podium. Dr. Hinson.
Thank you for that kind welcome, Dr. Robinson. I am here to offer the welcome on behalf of Baystate Health, but I also want to just share with you that I come to this work from a true place of passion. And being a native of Delaware and growing up in a space where per capita population, Delaware was the lowest of all states for infant mortality, and my mother being a social worker, I really became ingrained in understanding equity and wanting to know what we could do about it at a very early age. So this is a place and this is a focus that I'm very passionate about, and also related to cancer outcomes and impacts on family. So good evening, members of the community, colleagues, Faces of Faith honorees, and guests. As shared with you, I'm Dr. Tian Hinson, Senior Vice President and Chief Diversity, Equity, and Inclusion Officer, Baystate Health. As a partner and sponsor of the 2023 Faces of Faith event, I would like to welcome you on behalf behalf of Baystate Health. While I stand here as a senior leader at Baystate Health and the enterprise leader for EDI, our commitment to the advancement of public health and outcomes through reduction of disparities, elimination of structural barriers, and equitable delivery of healthcare services. I also stand before you as a nurse, a public health leader, and most importantly, a niece and a granddaughter whose life has been impacted by disproportionate suffering and death related to cancer within the BIPOC community. My personal experience, as well as the countless number of stories that I'm sure you each can share about the devastation of cancer within Black and Brown communities, is the reason why we are here today and really want to lift up this important topic. Baystate is deeply honored to be a sponsor in this critical work to advance this critical platform. It is disappointing to discover that Black or African Americans account for only 14.2% of our total population within the United States. Collectively, however, we have the highest death rate and shortest survival rates of any ethnic and racial group in the US for most cancers. This fact is staggering, yet this is our current reality. Some specific statistics include, alone in 2022, approximately 224,000 new cancer cases and 73,000 cancer deaths occurred among Black people in the United States. Black men have a 6% higher cancer incidence, but a 19% higher cancer mortality than white men overall, indicating lower survival rates among Black men. Black women have an 8% lower cancer incidence than white women, yet they have a 12% higher cancer mortality. This is primarily driven by the mortality rates of Black women in breast and uterine corpus cancers at 41% and 97% respectively. And death rates are approximately twofold higher among Black people than white people for stomach and prostate cancers and myelomas, representing the largest racial disparity in incidence and mortality. The most traumatic part of this story is that a substantial portion of these cancers and incidences are preventable. According to the American Cancer Society's report in 2022, at least 42% of newly diagnosed cancers are potentially avoidable. However, there are many determinants, as we know, elements of structural racism and barriers, access to care, socioeconomic status and social mechanisms, and comorbidities that impact all of these rates, and they must be addressed. An additional yet imperative piece of this story is also about reestablishing and creating a trust with our medical providers, culturally congruent and humble care, and health systems caring for BIPOC communities, and creating forums and spaces to reach, educate, and uplift those that are most vulnerable to these cancer risks. The aforementioned risks and facts highlight the realities of race, injustice, equity, respect, and disparities in this dialogue of cancer prevention, treatment, research, and care, and the resounding concerns of this ongoing, disheartening debate and reality within our nation around those domains. Community education events, such as tonight's A Community Conversation about Cancer Prevention and Survivorship, however, are imperative transformational changes within our society and among healthcare systems, providers, communities, public servants, and insurers that we must take on. Our work every day as change agents and providers must continue to speak up for patients that may not be receiving equitable care or adequate care, and be advocates through sharing of our voices with policy advocacy, faith-based community activities and actions, and grassroots efforts. Your focused and intentional efforts on cancer equity and the continued cultivation of culture that advances support for equitable screening access for early detection, cancer prevention education measures, and delivery of quality healthcare services with targeted interventions are imperative to reduce the chasm of cancer inequities within the BIPOC community, particularly within Black communities, until such a time when the discussion of race, injustice, equity, and disparities continue to exist no longer. On behalf of Baystate Health, the Offices of Diversity, Equity, and Inclusion, and Public Health, I welcome you once again to the 2023 Faces of Faith. I would also like to acknowledge our collaborators, the Springfield Health and Human Services Department, Caring Health Center, Focus Springfield, and Dom D Photography for your commitment to this work. We also extend our sincere appreciation to our panelists, our survivorship storytellers, and our honorees today for sharing your knowledge, your expertise, your personal journeys, and your gifts with us. Know that we at Baystate stand in solidarity with you to advance this critical work in cancer care and prevention for all communities. Together, let us stay committed to eliminating cancer disparities, mortality, and morbidity for every Black, Latina, Muslim, low-income, and hard-to-reach woman and man that we can touch and impact within Western Massachusetts and through across our region. Thank you.
Thank you, Dr. Hinson. So our next part of our program is we're going to begin our speakers panel, and I have the pleasure of reading their bios and introducing them. The first person I'd like to introduce is Darlene Francis, the woman in red. Darlene is a Springfield native and graduate of Commerce High School. She earned a BS in Business Administration from American International College and an Associate of Science degree in Medical Assistance from Springfield Technical Community College. She has managed medical practices for over 30 years and more recently has been the chairperson of the Afternoon of Pink for Mount Calvary Church, Baptist Church, promoting breast cancer prevention and awareness for over 10 years. It's a fundraiser for the church as well as Rays of Hope. She is the mother of 2 daughters, 3 stepchildren, 2 daughters and a son, stepson and daughter, right? Okay. And is the grandmother of 6. A fun fact about Miss Darlene Francis is that in 1973, she was crowned Miss Harambee Queen. Harambee, meaning pulled together in Swahili, was a very large community festival that started in 1968. Welcome, and thank you for being here. The next person that I would like to introduce is Archie Emmanuel with the mocha hat on. Archie Emmanuel is a Springfield native and graduate of Technical High School. He was drafted into the military, the Army, during the Vietnam War era in 1968 and stayed in the military until 1974. His first tour of duty was in Thailand and the second tour in Okinawa, Japan. Afterwards, he lived in Anderson, Alabama, where he attended Jacksonville State University for 2.5 years, studying physical education and sociology. He returned to Springfield in 1980, working multiple jobs until landing a position with the city's Public Works Department, and retired after 15 years on disability. During this time, he also attended AIC. He was diagnosed with prostate cancer in 2010. He married his earthly angel, Patricia, in 2011, and he joined MOCA, Men of Color Health Awareness, in 2012 as a mentor and advocate for men's health. Welcome, Archie. And now I'd like to introduce our Baystate physicians. Dr. Prarthna Bhardwaj is a senior hematologist, oncologist, fellow at UMass Chan Baystate. She completed medical school in India and came to Springfield, where she completed her residency and fellowship training. Her special interests are in breast cancer and hereditary familial cancer syndromes. She will be joining the Baystate Division of Hematology Oncology in July 2023. Welcome. And we have Dr. Eduardo Núñez. He is a pulmonary and critical care physician at Baystate Health and a health services researcher in the Department of Healthcare Delivery and Population Sciences at University of Massachusetts Baystate. He completed medical school at the University of Pittsburgh, residency in internal medicine at Brown University, and completed pulmonary and critical care medicine fellowship at Boston University and Boston Medical Center. His research interests include addressing disparities in lung cancer screening to improve mortality from lung cancer overall and among underserved populations. He also has interest in improving communication with patients through shared decision-making in lung cancer screening and in end-of-life conversations. Welcome. And last but certainly not least, Dr. Tashanna Myers. She is the Chief of Division of Gynecologic Oncology at Baystate Medical Center and the Medical Director of Clinical Trials Office at Baystate. She specializes in gynecology, oncology, and women's health. She is an associate professor of OBGYN, obstetrics and gynecology, at UMass School of Medicine, Baystate, as well as Tufts University School of Medicine. She is board certified in hospice and palliative medicine, GYN oncology, and OBGYN. Welcome. So as I moderate this panel discussion, I want to make everybody in the audience aware and people who are watching online to please feel free to ask your questions, to pose your questions. And since we are celebrating survivorship, I want to start with our survivors and let them share their stories and the role that faith has played in their survivorship journey. She's looking at me, so I'm going to call on Darlene Francis first, lady in red, to start sharing her story. Thank you.
Thank you, Kim. My story is one of those stories that I will say, don't do. It took a lot of years for me to come forward and admit that the lumps in my breast may not just be nothing. Fast forward, I worked in Connecticut, lived still in Springfield, went to do my exams. I did my exams most of the times, did my breast exams. I had very large breasts. I had fibrocystic breasts, which means that, you know, they find little fatty pockets of tissue in them. And so they put clips in them to watch them if they grow. They put chips in them, you know. And so what happens is, as you go and get your mammograms, they watch these chips in your breast to make sure that the lumps that they're next to don't get any bigger. So I was starting a new job. I had had my mammogram in October, September of the prior year, and I didn't want to take time off from work. You know, you didn't want to take time off from work, new job, so I kind of missed a year of mammograms. When I went to get a mammogram, they said, oh, something's different. Okay, I heard this story before, you know, you just kind of ignore it. Let's take a biopsy. Okay, so I've had the stereotactic biopsy. They're very painful, but they're very necessary. So I had those. Let's do an ultrasound. Okay, well, we did the ultrasound. Now, mind you, I'm in Connecticut. I work there, I go to the doctors there because that's where my insurance is. So, long story short, the technician comes in and he says to me, well, the type of cancer that you have. And I was like, what? And the escort that was in there with me, the MA that was in there with me said, no one has mentioned that to her yet. Well, he was so frustrated. She was frustrated. I couldn't hear anything but womp, 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 womp. But I knew I had to go. I said, I can't talk anymore. And they apologized over and over and over and over again. And I just had to get out. So I called my job. I said, I'm on my way home. And that's it. I went home. I prayed. If you think you have faith and life is going good, or, you have the little bumps in the road, you have to really dig into your faith when something like this, a diagnosis like this, comes at you. And you're alone. So it's you and God with this, why me? And then he'll say, why not you? Why not you? So it took me a while to get myself together, to be able to even talk about it, without choking up and crying. And sometimes too, now when I tell the story, I get a little choked up. But it takes a while. Had it not been for my friends and family that embraced me and made a cocoon around me, it would have been so much worse. So then you talk to the surgeons, you talk about reconstruction, and there's always, I'm a glass half full girl, so there's always something that's got to come out of this. There's a reason for this to happen to me. No one in my family has ever had any problems like that, just me. So you go through the doctors, they tell you what's going on. You have to bring somebody with you because all I heard through the whole thing was, want, 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 want. We're going to do surgery this day, want, 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 want. You might expect this, do. And even though it's written down, you don't want to read it. You want to stay away from the internet. You want to stay away from everybody at some point. So you need that person to say, hey, you need to go do this. You need this blood work. You need something else be done as you progress on. I'm going to be short. So you go, you have your surgery. So one funny story I have to tell when I had my surgery. So they put you in the room, they do the surgery. I'm not going to get graphic. And then you come out and you're in recovery. So they give you some very, very, very good drugs because you're in pain and you're all cut up and, it is what it is. So I go to the bathroom and I come out and I flush the toilet and I go, oh my goodness, look at that color blue. That's the tidy bowl man. And I'm like, do they still make tidy bowl? Now, those of you that are younger don't remember the tidy bowl man, but those of us that are older, we remember the tidy bowl man in the toilet. So, that went on. I'm like, oh my goodness, that was so pretty. So that went on for the rest of the night. And then the doctor comes in and I said, my goodness, they really do a good job here. They even have tidy bowl in the toilets. The doctor said, was it blue? Was it bright blue? I was like, yeah. He She said, well, that was the dye coming out of you that we had to put into you so that we could find out where the cancer was, and now you're just getting rid of it. So, so that, you know, you have to look on the bright side of everything. There's a reason, and, you know, that story took me through a lot of tears and a lot of heartache and a lot of pain. But one of the things I want to get across to people is we have to talk about it. You know, we can't be in a cocoon, because that is a traumatic experience to go to. You know, I have bilateral mastectomies, and so, which was a good thing because they found cancer in my good breast. Had they not told me, or had I not had it removed, I wouldn't have went through this again. And I may not be here to tell you the story today. So, you know, talk to somebody. I didn't know that anybody had breast cancer until I gave my first fundraiser for the church. And I asked for prayer for the survivors. And what we do at the end is we have a prayer circle for all the survivors. And all the women that came into the circle, I was amazed. I was shocked. Because I could have picked up the phone and been able to say, hey, you know, are you doing this? How do you handle this? What kind of experience is this? Because we're all in this together. We have to work through. I tell my story to anybody that'll listen, you know, because I want folks to know that you can talk to me, you know. You can talk to me, you can talk about being angry. I was so angry. I was just angry. And, you know, once I got through that, it was like God has a purpose for everything. God will bring you through this, and there's a reason that you're going through this. So, but there was no one to talk to. So that's why I do my fundraiser. That's why I am so glad that you asked me to come and speak, because there's a story to tell. And people, you know, women, men, because men get breast cancer too, talk to somebody, you know. Don't go through it alone. It's tough enough to go through, but going through it alone and in silence and into yourself, it's miserable. It really is. And I just want to thank you all for listening to me. And if anyone wants to talk, I'm available. You know, if you want to share, because sometimes you just need somebody to listen there and go, somebody that knows what you're talking about, you know, that has been there, that can experience it. And sometimes you can just have a laugh at it. Girl, that happened to me too. You know, something like that.
Thank you, Darlene.
You're welcome.
Greatly appreciate you sharing your story. Does anybody have any questions that they'd like to ask Darlene at this moment, or you can wait until we hear from some more speakers? Are there any questions online at this point?
Not at this time.
All right, thank you. Do any of the panelists have any questions that they'd like to pose to Darlene? Not at this time? Okay, great. Thank you, Dr. Myers.
Thank you for sharing your story. What I would say is, as a physician, even though I'm walking into people's cancer stories all the time, I do tell patients that it's the first time for you in this story, and it's important to have someone. And, you know, I said, we have cell phones now. I said, you can call anyone in the world, right? And so if your person can't physically be there because they have jobs or they have childcare issues, or, you know, call them. We can video chat now, we can conference call, we can bring in as many people as you want, actually, because it is a reality that you hear and remember a third of what will be said. And for me, as a physician who's passionate about everything I'm telling you, I want you to get the other 2/3. I want you, when you walk out in that parking lot and you're like, did she say we're gonna fix this? I want you to have that person that you can be able to say that to. And so bring somebody, and write notes, and ask people to repeat things. It is your time. This space, it doesn't matter who's on the outside. It doesn't matter. It's your time with that person, and you should get what you need from them. So thank you for sharing your story and highlighting those things. And anger is common. It's grief. And you're entitled to it. And what I try to create in that space, in that consult room, is a safe space. Because when you walk outside the door, you're someone's mother, you're someone's sister, and you want to be strong, right? You don't call your children because you want to protect them from this diagnosis and from this thing. So in that room, you can cry. In that room, you can be angry. In that room, you can be scared. And you can ask the questions, right? So I asked, do you want to know the prognosis? And so use that time to ask the things. It's a safe space.
Thank you, Dr. Byers. Thank you for that. Dr. Bhardwaj, I had a question I wanted to pose to you, but I also want to hear what you were about to say. I would like to hear more about when to start screening for mammograms, but go ahead. Thank you.
Yeah, and I think, my first thing would be with regards to what Darlene shared, and then I'll get to your question. Thank you for sharing your story, Darlene. I think something that struck me about what she mentioned was being, caught unaware about a diagnosis of cancer. It's not uncommon, when people come in to see a medical oncologist that they haven't been told yet that they have a diagnosis of cancer. And so it's important, if something doesn't sound right, or if you're being referred to somebody, to get as much information as possible from whoever is providing the referral. But oftentimes, when people are caught unaware, it is really important, like Dr. Myers said, to create that safe space and making sure that you bring in a family member along with you or a friend along with you to kind of navigate that situation. With regards to the question that you had regarding the screening mammograms, typically they say anywhere between 40 to 50 years for women, depending upon which society you're going after. The American Cancer Society recommends 40 years to be the initial mammogram, initial screening mammogram. Especially for women with a history, family history of breast cancers, they recommend starting at 40. However, if you do not have a family history of breast cancer, anywhere between 40 to 50 should be fine.
Thank you. And now we're going to move to Archie Emmanuel to share his story of prostate cancer survivorship and the role faith played.
The growth of faith. To tell my story, okay, I'm grateful to be here and still be here. Okay, mine is kind of different from Darlene's. It's like my earthly angel, that's my wife, my partner. If it wasn't for her, I don't know if I would still be here, okay? Because we've been knowing each other on for 40 years. It seems like 40 years we've been married. Been married for 12. Okay, so we got together and so forth. I invited her out to a function. So one day on the phone, she says, "Uh-oh." She calls me Emmanuel, right, by my last name. And she said on the phone after our second date, "Emmanuel, are you falling in love with me?" So normally 30, 40 years ago, I would just said something, you know what I'm saying? But with maturity and growth and experience over the years, I thought about it and I said, you know something? I've been a knucklehead, because I probably been in love with you all the time and just didn't want to face it. Well, anyway, at this time, I'm gonna say this, I've been married 3 times. They say 3 times is a charm. So after the second one, I told God, I said, look, I can't get it right. I'm gonna leave it alone. Maybe it's not meant for me to be married or not. But if it is, you choose them. And at the same time doing this course, my journey, she was saying the same thing. So got back together on this. So I said, got engaged. So she said, we need to get checked, see what we have and don't have. I said, I don't have no problem with it, you know, and get checked head to toe. So I did my annual checkup. The urologist said, we're going to need to do a biopsy to see if it's possible you have cancer. I'm not, you know, I'm kind of ignorant, prostate cancer. You know. He said, so after the biopsy, which was traumatic to me. But anyway, I got through that and came back, he told me that I had prostate cancer. And I said, you know, I looked at the wall in the office. You could have told me anything but cancer. Because you think it's cancer, okay, how long I got? You know, how serious it is. But through my research after that, I found out there's stages. Lucky and fortunate for me, it was in the early stages. I said, okay, let's nip this in the bud. I don't need surgery. He says, well, there's several things you can do. You can do surgery, radiation, and so forth. So, okay. I have to leave, go home, and tell my wife, my fiance, that I have prostate cancer. I said, oh, Lord, like Darlene said, why me? Why now? Maybe she doesn't want to marry me now. You know, all these thoughts run through your head. I was already numb and then lost. You know, wasn't for her. So I get home, and doing my prayer, talking to God, he said, well, just come out and tell her. That's what I did. And I was surprised. She said, and so I got your back. Oh, I said, oh, wow, that's all I needed. My feet hit the ground. I went researching something because I didn't know anybody. Trying to find people that was prostate cancer survivors. And I ran across on the internet this group, prostate cancer support group, Main Street. I went down there and went to the meeting. So after about the second meeting, everybody else in there had been through treatment, had been having prostate cancer for years, all different procedures they had. It was blowing my mind. I ain't had no treatment, so I'm just here. So they saying, well, we're all survivors. I said, who you talking about as a survivor? They said, you still here, aren't you? And I thought about it. Yes, I am. So one of the facilitators to the prostate was affiliated, Dr. Sanford James. He introduced me, told me, he said, look, he says, there's a group of guys who would like to hear your story. I said, oh, wow, there's that think like me, you know. And so he said, MOCA, Men of Color Health Awareness. So I had to go through rehab because I already got married, but I wanted to get married before my treatment because you never know the outcome to the side effects. So my wife agreed, fiance agreed with me. I went through, after I got married, I went to pre-treatment where I was violated. That's all I'm gonna say. Ain't nothing sacred on me, okay? I told her, you know, it's wow, all these sticking here and there. So, and I haven't even got to my main treatment for the prostate cancer, a whole year. And my wife keeps saying, oh, don't be a baby and something. I said, babe, you just don't know. But thank God I had her, my earthly angel. And I went through that and so forth. So I came back from Boston after 2 months and got into rehab, the why I had this program called Live Strong, build your strength back, you know. So after that, during the time I was corresponding with MOCA, I joined MOCA as a cohort they had, and went through the program. And I was, the facilitator suggested I become a mentor because I had a story, my journey and so forth. And all the time, my journey, you know, you never think about, you know, if you don't have the significant other, it's like Darlene said, it can be depressing. You need some support. You need to be around other people. So these men in the group helped me. So after my treatment, after I joined MOCA, so I stopped going to the support group because I could tell my story to MOCA. And you never know who's in that group. We put men in a group and we tell our story. And I kept getting more comfortable because it's been a long time since I spoke in front of people. I haven't done public relations in almost 40 years. Now you want to tell me. And my other brothers, you know, we go to do all around advocacy for prostate cancer, for black men or men of color health. And so one day I was out there, I was the fourth one out there at the library, and I asked Lamont, I asked Brother Al, I asked Hank Douglas, y'all gonna do the presentation? No, we ain't gonna do the presentation. Oh, so y'all gonna just throw me under the bus. But it was an experience. They knew. You know, they listened and heard my story. And I appreciate that. MOCA is out here. We care about other men. We want men to be around for their family. You know, stop being selfish and thinking that, hey, it's about me. It ain't about you. You know? It's us and we. And MOCA's been out here for about, what's 12 or 13 years, ground root. You know, just speaking, making men aware, educating, giving you tools so you can fight them. Because we dropping off fine. You know, it's one thing to be ignorant. And I always tell men when I tell my story, you know, don't you want to know what you have or what you don't have? So you have the opportunity to do something about it
Absolutely.
at least. You know what I'm saying? So, you know, listening to other men, you say, well, wow. Because men basically only talk about certain things with men. Yeah. And you know what that is outside of sports, okay? They're comfortable talking about. But when it comes to health, we closed up about it. But when you get in that circle and hear somebody's story, you say, oh, wow, I didn't know that. That might can help me, you know. And now that I'm a mentor and I talk to these guys, they say, wow, Archie, you know, you help open up. I'm glad I come to the class. And MOCA keeps me focused on what I'm supposed to do, my medication, my health, and going, and like I said, out here making men aware what's out here, and it's killing you, you know. We're all afraid. You fear the unknown. That's what scares me, the unknown. I tell them, man. And you got partners, we talk to the women, you know, and say, oh, I'm trying to get my husband. So, you know, bring him to me, I'll talk to him, or one of the mentors, you know. So I'm still here after 13 years. Thank you very much for me being on this panel. Okay. If you have any questions,
Thank you, Archie. Appreciate that. And don't you all have an event coming up this Saturday on the 29th? Is MOCA a part of that?
Yeah,
Yes, we are.
the Moscow.
Okay.
We're going to be up at Mason Square Health Center instead, just speak a little bit about men's health and continue the work that we do in the community.
Great. That's excellent. So do any of our panelists have any questions that they'd like to ask Archie? Or are there any questions online or from our audience? Yes, I'm sorry.
Archie, thank you so much for sharing that story here and for sharing your story with the Men of MOCA. It's such a powerful story hearing about how you overcame the fear of cancer. And it's such, we're all afraid of cancer because I think we've all known or have heard of somebody that has passed away from cancer, unfortunately. And that fear prevents people from seeking care. It prevents people from getting treated. So it's, often when I deal with lung cancer screening and I tell my patients, would you like, there's a test that we can get to check for lung cancer. And as soon as I say the word cancer, people are emotional and they don't want to hear more. They're like, no, that's not for me. And the same thing happens when you find out you have a diagnosis of cancer. You have cancer, and it's an emotional response. And the first thing you want to do is deny it and not want to seek treatment. And so that's why this event and survivorship is so important, is that we need to hear these stories. We need to hear from people like Darlene and Archie to know that we can beat cancer. And, trust your family, your friends, your faith, your doctors, that together we can treat and beat cancer. So thank you, Archie, for sharing your story, and Darlene.
Are there any other questions from the audience? Any questions online? No? Well, I have a few. Dr. Núñez, can you share with us what some strategies for addressing disparities and barriers to preventing cancer?
Yeah, thank you, Timothy. The work around cancer has been around for decades, and there's still a lot of work left to be done. So there's a lot of things that have been, I think, like we mentioned, survivorship is a very important strategy for addressing disparities in cancer. I think raising awareness, so the Pink Ribbon campaign, every cancer group has their own awareness campaigns, knowing what the exams are for those cancer tests and trusting your doctor. And I think we talked about fear of cancer. There's also stigma with cancer. I deal a lot with smoking and smoking cessation, and the advertising media makes people feel like they're doing this to themselves. They say, hey, if you can't quit smoking, you're going to get cancer. When really the truth is, you walk in the bus stop and there's some media advertising towards you to smoke cigarettes, and the companies put the addictive substances in there. So it's very hard to quit smoking and to take care of yourself. And we make people feel like there's a stigma around stopping smoking and getting yourself checked for cancer. So addressing that stigma is part of the barriers and raising awareness. And I think the other part is, navigating people through this complex, it's not always a straight, oh, you have cancer and now it's treated. There's a whole continuum and pathway along this step. So we need to navigate people from the beginning, from getting what to expect before you even get the scan. There can be, a lot of results, nodules, spots that are not cancer, and those cause anxiety. Those aren't harmless either. But guiding people from the beginning, before the exam, to the screening exam, and then through the oncology visit, treatment, and then survivorship. And so we need to take into scope the whole approach to cancer.
Thank you. I have a question for Dr. Myers. I was hoping that you could share with us the relationship between HPV, human papilloma virus, and cancers, cervical cancers, and also some of the risk factors related to HPV.
Sure. I just wanted to piggyback because I'm here sort of talking about cervical cancer, and there is a lot of shame that comes from that diagnosis, which prevents women sometimes from seeking care or talking about it. What we realize is that cancer is really about your immune system, right? In theory, we see toxins all the time, and our bodies develop cancers, but it recognizes it and clears it. But there are times when our immune system allows that cancer to grow, and it can grow in different parts of the body. And so it's complicated. You can have, 10 people that smoke, but only 2 of them get cancer, right? And so it's not clear, but it's multifactorial, and not sharing our stories, not understanding when you're at risk. So like, you need to know what grandma died of, right? Like we need to tell our stories and share that because it is life-changing. I've taken care of families. So there are a lot of genetic mutations that are highly studied in, non-minority populations. We have a ton of mutations in our, people of color. And so, we're not the typical phenotype for these genetic mutations, but when you realize that like that cousin had breast cancer and that cousin had ovarian cancer and that cousin had colon cancer, it tells a story. And we just need to keep that story going the way we have all the other stories going. HPV is a virus. And again, it is believed that everyone who has sexual intercourse gets an exposure at some time. As you get older, your body's immune system to clear that virus decreases. And so that virus can then cause precancerous changes in the cervix and then ultimately lead to cancers. So when you think about it, if 1 million people get exposed to the virus, 100,000 may have an abnormal pap smear. So a pap smear really is your screening test. It's going to say, are you someone who's at risk for cancer? And if you're for cervical cancer, if your pap smears are always negative, then you're in a low risk population. But if you have ever had an abnormal pap smear, even one, you're now in a surveillance group. You're now someone who is potentially at risk for developing that cancer in the future. And so you should behave as such. You should stay on top of the pap smears, make time for it. And we recognize that it's challenging, right? Our doctor's offices are open exactly when you're at work, right? Like, we as a healthcare have to take some ownership that if you're gonna take time off from work, I'm a mom, I'm gonna take my child to the pediatrician, I may not go to the gynecologist. Right? And so we make these changes and these bargains. And so we have to figure out, like, wouldn't it be great if I could like have my kid seen and get my pap smear the same day and walk down the hall and get my right? Like creating places, or guess what? We're going to have a session that goes from 5 to 8 for gynecologic care, and we have childcare for you, right? So we have to start thinking as a healthcare system about what does our community need? And how do we provide it? And so this virus, again, can behave differently, but it is associated with 80% of cervical cancers, and why we now screen for it with your pap smear. And so I think, when you get your pap smear result, it's good to ask, and what's my HPV status? Were the cells normal, and what is my HPV status? And have your results explained. I think the number one thing that I wish never existed is no news is good news. It is like the worst. I always want an answer, right? If I got a test, I not only want to hear that it's negative, mail me a copy, send it through my portal, text me, right? We get 1 billion emails and texts of information that is not useful. Get your data, know your information, and it's your healthcare team's role to explain it to you. It's medical, it's okay, that's my job. That's my nurse's job, that's my MA. What does HPV mean? Like, put some of that work back on us to own your own information.
Thank you, Dr. Myers. Any questions from our audience at this point? Denise.
So my question is for either doctor, and this is, I heard a little bit about you talking about hereditary cancers. Are there any studies that are going forward now or expected to go forward to get families involved to find out more about our histories?
So I think, with regards to hereditary cancer syndromes, there has been quite a bit of research that has been done, and it's work in progress. With regards to what we're doing at Baystate, we have a genetic, a team of genetic counselors available, and oftentimes they require a referral from a primary care physician. So if somebody has a strong family history of cancer, they often get referred to this clinic. And we have a weekly multidisciplinary meeting of sorts with our medical oncologists, genetic counselors, and our administrative staff to identify if it's appropriate for them to undergo genetic testing or not. Because not everyone who has family history of cancers have genetic mutations, and there are certain types of cancers that have been identified to be associated with certain genetic mutations. So we don't want to be over-testing, so we have to identify the right people who can, go ahead with testing. So that is certainly done at Baystate. And, with regards to studies being done, I think now the push is a lot more for, how therapeutics can play a role, in the sense that people who have these mutations, now there are medications targeting specifically these mutations. And I think perhaps Dr. Byers can talk a little bit more about that as well, because especially common to use it in people who have breast cancers and ovarian cancers as well.
So I think that's where the history, what Dr. Bhardwaj's team does is they take the data you tell us, which grandmother, which side, which aunt, which uncle, and they determine your risk. So when you say, oh, my cousin had cancer, it puts us at a deficit to know if you're truly at an increased risk. So knowing that type, going with family members to meetings, what kind of chemo they got, I think helps us to make the decision. So yes, we're still using what you tell us to figure out if you need to be tested, but some cancers we know have a higher risk of genetics, and so you'll get a diagnosis of a certain type of cancer. So cervical cancer is not known to be genetic, so I wouldn't offer that, but every single ovarian cancer does, and some endometrial or uterine cancers do. So we're sort of selective. What we're also looking at, more interestingly, is the biology of the tumor. So the types of tumors that may be found in Black and brown women may actually be different than the types of cancers we find in other women. And we're studying the biology of the tumor and directing the therapy, and that's what's precision medicine. So it's no longer every ovarian cancer gets the same thing. Susan's 137 ovarian cancer needs this treatment versus, Jackie's. And so that's what we're pushing. But a lot of that work happens through research. People have to be willing to donate their tissue, donate their blood. That's a big deal in our community. We have a lot of apprehension around that, understandably. That we don't want our information, we don't trust where that information is going to go. But the way science is moving, we are going to be left behind if we are not included. Because the drugs they're looking at are looking at specific tumors. And if your tumor's not in there, when that drug comes to market, it will not be right for you. Right? And then the disparity grows.
We have another question from the audience. Dr. Robinson?
So I was, Dr. Myers, you sort of beat me to my question because I was going to ask a question around research as we were talking about this, and I was going to see if we could somehow flip it back on the health system, health organizations. What do we need to do differently to engage our communities in research? So we often knock the community for being resistant and not trusting, but we're not doing very much of anything ourselves to engage the community. So how do we flip the script? How do we take a more proactive role in engaging the community?
I guess I've been selected to take this. But it's about building partnerships. I think there's a lot of reasons why there's distrust and why people don't want to come forward and participate in research. And so I think, and I take it responsibility from the healthcare system. I think it's on us to come out to the communities and invest and not just be like, okay, we're only gonna be here for the time that the trial is going on, and then we're gonna move on to the next place. Like, we're really there for the long term, and we wanna build this relationship. And because the community will give back. The community will help out the researchers and participate. But I think, at least that's my perspective, that we need to reach out our hand first and make sure that we're building that partnership for the long term and not causing harm and making things worse.
There's also a lot of myths that if you ask a person of color to participate in a clinical trial that they won't. That's not actually true. What happens is clinical trials are like being invited to a party, and we are not being extended the invitation. So we have biases in medicine, and they, we talk about it all the time, right? So Susan's taking a hit today, but Susan comes late to all her appointments. I'm not gonna talk to Susan about a trial. She's not a good trial candidate. We have to stop that. If Susan has a cancer and we have a study, she's a trial candidate. Why don't we figure out why is Susan late? Oh, because we give her a 9 o'clock appointment and she has 2 kids she has to drop off at school at 8:30. We're the problem. Susan actually needs appointments later in the day, and we just need to start thinking about things as, what are the social determinants of health? What are the issues? Right? So are people having a hard time eating? Are people having a hard time taking the bus? So I have a patient who took the bus to my appointments. And I was like, why can't she come at 8 o'clock? And they're like, because she takes 2 buses and the buses don't start. And I was like, oh, well, that wasn't in the chart. Right? Like, I'm limited by what I know. I'm not from this community. I haven't taken the bus. I didn't get it. That it's 2 buses. And so, it's things that we just have to become painfully aware of. And it's our community, right? Like, I don't need to learn it about Boston. I need to learn it about Springfield, right? And so that's doable. But I need you to teach me. I need you to invite me, right? When you have your health fairs, I need people to know who I am so that when their aunt gets referred, and it happens, right? They go, I heard you talk at my sister auntie's church. And I said, did I do a good job? They said, you were awesome. I said, okay then. And because I have to build trust fast, right? It's cancer. And I need to be able to create that safe space. And yes, it's great that, if you're a Black person and I'm a Black person, but I trust Baystate Health, right? I trust doctors that don't look like us, because I do believe that we have phenomenal physicians in this community that really want us to be healthy. And so, sometimes I can't promise you that every person that you come in contact with at Baystate Health is gonna look like you, but what I can promise you is that what is most important to them is giving you the best care possible. And so at the end of the day, we put aside our biases and get the care that we need.
Thank you, Dr. Myers. I believe we have a question from our online audience.
Thank you, we do. So we have a question from Marcella. I have 3 family members. 1 is a second cousin, and 2 are third and first cousins that died of pancreatic cancer, and a second cousin died of the same cancer, and now my cousin has just been placed on hospice again with the same cancer. My question is, do I need to be more proactive in screening? And the follow-up to that is, the third cousins are brother and sister, and the second cousin was the mom, all on my mom's side. My mom had Hodgkin's lymphoma, and so did my brother.
So thank you for the question. So Hodgkin lymphoma by itself doesn't tend to be hereditary, so we can kind of, not worry about that being something that, this person is likely to inherit. With regards to pancreatic cancer, I think, it's important for this person to find out if the if the relatives have had genetic testing done already. It's now pretty standard for all stage 4 pancreatic cancers, people who have the diagnosis, to undergo genetic testing. And if they have some genetic mutation that increases their risk of pancreatic cancer, then I think it's reasonable for this person to get tested as well. And, it doesn't mean that, if they have the mutation, that this person needs to have the mutation. So it's still important to get the testing. And based on what the testing shows, you can decide whether they need pancreatic cancer screening or not. If they do have a genetic mutation and a family history of pancreatic cancer screening, yes, it is recommended. And now at Baystate, we have started pancreatic cancer screening as well, with either an MRI of the pancreas or an endoscopic ultrasound, which is done alternatively. So I think that would be the way to go. And like Dr. Myers was saying, it no longer is a one-size-fits-all approach to treatment of cancers. We really want to identify what is the personality of your type of tumor in order to determine treatment. And for pancreatic cancers, doing a genetic testing is part of it, because we do have medications for certain types of mutations.
Can you give the person who's online some contact information? I'm not sure if they're local, but that would be helpful.
Yeah, absolutely. So first of all, if they have a primary care physician, I think a referral to the Baystate Genetics would be a good way to go. And again, not all of these people will end up getting the genetic testing, but we have a process in place where we can screen whether they qualify for genetic testing or not. I think we'll need some specific details with regards to age at the time of diagnosis and whether they've had genetic testing done. So Baystate Genetics is probably the first place for them to start. Okay.
Thank you. Are there any other questions? We're about to wrap up and move to the next section of our program, but I see Reverend Dr. Rucks has a question.
Yes, and I was debating on whether to ask it, but when Marcella asked her question, it seems that we do a lot around prevention, but I'm baffled about pancreatic cancer in particular. And with her question, the flag for her is because of family. But I don't understand why we don't have something for people to test, because it seems like every time it's so far gone by the time people discover.
Yeah, I think pancreatic cancers in general are pretty aggressive cancers, unlike a lot of other cancers. And I think, a lot of strides are being made into trying to catch them early, but then again, in the absence of very strong risk factors, there currently aren't any screening guidelines available. But that's not to say that this is not something that may change in the future, because there's active research going on. And part of the concern is also over-testing, the anxiety that comes with over-testing, false positives, what do you do with those? And what is an individual's risk of actually developing this cancer, and do they truly need that, screening? Those are things that are being ironed out. I wouldn't be surprised, in, let's say, the next few years, pancreatic cancer screening becomes a thing. I think strides are being made currently in terms of how we treat it. I think, previously, for a lot of people, diagnosis of, stage 4 pancreatic cancer meant probably like a few months. That's changing with some of the treatments that we have available now. So yes, I think I wish we had screening for every type of cancer, but these are things that are currently work in progress, and hopefully things will change in the future.
Thank you. Thank you. Do we have any final remarks or comments that anyone on our panel would like to make about this evening's discussion, or anything that is just pressing and you just really want to get it out? And I thought I saw a hand, one more hand in the audience. Was Brenda?
My question is, in regards to the genetic testing, is that really offered to Black and brown people, realistically?
So again, Great question. In terms of, it depends on what context we're talking in here. So with regards to treatment, there are certain cancers where we offer it routinely for everyone. So with regards to treatment, yes, it's offered to people of color, everyone, basically. However, with regards to screening, if you don't have a diagnosis of cancer and you want to find out, am I at an increased risk of having cancer through having a genetic mutation, it really depends on who is advocating for you, whether it's yourself, your primary care physician. And if either of these people aren't, then you may not get it, which is why it's important to be proactive, advocate for yourself, leave fear behind, and ask. You have nothing to lose. So, yeah.
Thank you. Can we give our panelists a round of applause, please? Oh, I'm sorry. Did I miss somebody? Oh, Lamont, I'm sorry.
Yes, we spoke.
Question.
Yes, we spoke earlier, and we was talking about why we don't go in and do trials and how we're so skeptical of it. And I truly believe, because as I went through my trauma with cancer and tumors and et cetera, I went on a drug called Gleevec that saved my life, and it's been over 18 years. And I went down with it. I had to stop. I had to go back in again and go back and have surgery. They took me back on it again for another 5 years, which only is supposed to last that long. I went back again, and here I am today on the same drug. Now, I may have to take it for the rest of my life, but I truly believe that if I don't go in and try and see what works for our community, for black and brown people, we don't have no clue, and I can't be afraid if I want to live. So I really, truly believe that I didn't need to see a doctor was whether he was black, brown, or what other ethnic color. I need to know that he was leading me in the right direction, and I seen that it was saving my life. And I know that I passed that on, as Archie spoke earlier, when we go out and talk about prostate cancer and health disparities throughout the community, that it's so important that we let them know that some of the things we went through, and I can't look back what happened with the Tuskegee situation. I think we're past that. I think COVID also allowed us to open our eyes up to see that if we don't do something about some of the health disparities, that we're going to die. And we lost quite a few in these last 2 to 3 years. So as I look forward to going out and continue to advocate and educate and speak to other men and people in my community in color, and also to continue the work that we do in Springfield with the surrounding hospitals, Baystate, Mercy, all the health centers, I really truly believe that we're going to have some doctors that really will want to stay into our community, to be doctors, and continue to work through this so that we can continue to educate not only ourselves but our families and our children. Thank you.
Thank you so much for sharing that. So we can't be afraid if we want to live. Good takeaway. So at this point of the program, we're actually here. The reason we're here this evening, besides having a community conversation on cancer prevention and survivorship, is to recognize and celebrate our 9 honorees, Faces of Faith. So at this point, yeah, you can clap. Thank you. So at this time, I would like to bring up Denise Stewart, who is a 2022 Faces of Faith, and Brenda Evans, who is also a 2022 Faces of Faith, and they were part of this year's planning committee. But before they do that, I also want to recognize 2 other people in the audience, Janet Nazario and Dolores Munin. They were also 2022 Faces of Faith honorees. We couldn't do it in person last year, so I'm glad they were able to come out tonight. Huh? No, I want you to come here. Come up here. Frank is trying to tell me something. You want to come up here? Oh, I'm so sorry. Dora. Good looking out, Frank. Dora Robinson, I am so sorry, and I've been looking at you all night. Dora Robinson is also here, and she was a 2022 Faces of Faith So come on up.
Good evening, everyone, and thank you for being here tonight. And this gives us a great honor, and we're happy. I know I'm happy to be here with you on tonight, and so happy for this award that we have received on last year, and our awardees of tonight. And we thank God for each and every one of them. And it is my privilege and pleasure to introduce to you our first face of faith for this year, and read to you her statement of faith, which is, God did not fail. I was diagnosed with thyroid cancer in 2018. Though difficult to accept and with sadness upon me, our faith kicked in quickly, and my husband, Pastor Jesse Burgess, and I began to pray. God did not fail. He put me in the path of the most qualified and hard-to-get doctors and surgeons. My care and aftercare were expedited. The radiation was hard due to the separation, but God kept me in the midst. I am so grateful. It could have been worse. Faith, prayer, and patience with God's word is what has taken me through this trial. It is my honor and privilege to present to you this year's 2023 Face of Faith, Stephanie Nicole Burgess.
Good evening, everyone. Our second Faces of Faith honoree, God's Promise. My faith journey began at the age of 5 when I gave my life to Christ. I have been through mountain and wilderness experiences. I've been diagnosed with cancer 3 times, colon, lung, and prostate, and have survived physically and emotionally in the darkest of times. In the scripture, Isaiah 43, God promised, I will be with you, for I am the Lord your God. God gives me the confidence, strength, courage, and even joy that I can get through it. I present to you Reverend J. Willard Cofield, Jr.
I was a little bored, so I had to wake everybody up.
Yes, he did.
Oh, there's only one.
Only one.
Amen. Amen. All right, settle down. Angel by my side. I am a 13-year prostate cancer survivor, and I'm grateful and humbled to still be here. I've been blessed along this journey because I have not had to go through it alone. I have heavenly and earthly angels by my side. Both have given me faith, hope, and strength. It is my honor to present to you this year's 2023 Face of Faith, Mr. Archie Emmanuel, Jr.
My assignment, my faith. When I was informed that I had breast cancer, I asked God, why me? And he said, why not you? I was mad at God for a long time. I knew he had a plan for me, but it was hard to understand. Once I accepted the fact that I had breast cancer, I asked God again, why? My close friends and I prayed while awaiting an answer to my question from God. I am a firm believer that everything happens for a reason. God put it on my heart to get folks to talk about breast cancer, educate them, and let them know that they are not alone. So every October for more than 10 years, I have chaired the Afternoon of Pink for the Mount Calvary Baptist Church. It is a fundraiser for the church and Rays of Hope. The program is always the same: educate, discuss, pray, fellowship. I have my assignment, my faith. May I present to you my sister from another mister, Darlene Francis.
God's blessings. Building and maintaining relationships means a lot to me. Over the years, I've developed trusting relationships with my doctors. After receiving a diagnosis of prostate cancer, my question was, where do we go from here? My faith in God helped me trust my doctor's medical guidance. They explained the next steps, and I followed the recommended treatment plan. I thank God for blessing me with knowledgeable doctors, a loving family, and the opportunity to share my story with others. It is my honor to present to you this year's Face of Faith, John Skip Miller.
My higher power. In 2005, I was diagnosed with GI stromal tumor of the stomach, also known as GIST. My first thought was I have cancer and I'm going to die because my younger sister died of breast cancer in 2000. Being a Christian, I prayed and asked God, who is my higher power, to get me through. I participated in a clinical trial for 7 years to shrink the tumor, which was attached to other organs. In year 8, the tumor returned, and I was told I have to take medicine for the rest of my life. 18 years later, I am cancer-free. As the project director of MOCA, Men of Color Health Awareness, I praise God for using me as a vehicle to educate other men and women about health disparities that plague our community. Remember, never give up the fight. And I would like to present to you my MOCA brother, Lamont Scott.
God's grace. My last mammogram was normal, or was it? I received the news with the thought that God must feel I'm strong enough to go through this. It took me a while to say it out loud. I have cancer. I called my son, who simply said, "We will get through this." 2 surgeries, chemo, radiation, loss of hair, loss of appetite, loss of time from work, all while trying to keep life as normal as possible. But some days that was impossible. Mad, sad, hopelessness filled those days. Today I feel courageous, victorious, happy, and grateful for a second chance. So many around me have lost the battle, but with God's grace, I am still here. It gives me great honor to present to you this year's Face of Faith and my best friend, Charlene Scott.
Believe, blessed is she who believed the Lord, who would fulfill his promises to her. Covered by the precious blood of Jesus. Luke 1, verse 45. And it gives my pleasure to recognize, she's not here with us this evening, a dear friend, a family friend, Paulette Henderson-Small.
Peace be still. As I went through the various tests that ultimately revealed that I had breast cancer, I had a keen sense of calm and stillness within me. When I was finally informed, my first and only reaction was, God, I want to live. But whatever you decide is all right with me. It was a quiet journey in which I was keenly aware of God's spirit and angels. God and I were good, and I had total trust in him. God and I were good, and I had total trust in him. My faith in God and God's divine providence granted me a wonderful sense of peace. It is my great honor to present to you this year's Face of Faith, the Reverend Dr. Karen Louise Rucks-Walker. And it was indeed a great honor to also take a portrait of each of our honorees. And I thank Baystate Health and, of course, Kimothy for pulling me in on the project. I couldn't be more honored. Thank you.
Thank you both. Beautiful unveiling of these beautiful portraits that you took. And so now we are at the point of our program where I'm going to bring up Dr. Frank Robinson again for acknowledgments and a call to action.
So let's acknowledge our mistress of ceremonies. So, we doing this again next year?
God willing.
So we've had this conversation a couple of times, and as we've gotten closer to the event and Kimothy's anxiety grew, she was a little anxious about, why are we doing this? You know, we had this conversation. We invent these events because it's really a good idea, but then as it begins to come upon you, you begin, why did I do this? You know, why me? And so I think we've gotten past that, and I think I'm sensing, yes, we're probably going to do this again next year. So again, Kimothy has done a remarkable job, as is her team. And so I'm going to start with the team because they've been quiet in the back. And so this planning committee has been meeting, I think, weekly forever. I bet they feel like they've been meeting weekly forever. So at the top of the list, Anna Marie Golden. Where are you, Anna Marie Golden? Wave there. Bishop Bernard Richardson, is he in the room? All right. Brenda Evans, I see her. Yeah. Sharice Burston, where's Sharice? Oh, she leave? All right, so Sharice is left, but she was here earlier. Denise Marie Stewart, Don B Photography. Great. I don't see J.P. Morgan in the room, but J.P. is on this committee. Reverend Marcus McCullough. He was copiously taking notes during all of the renditions. So he's getting prepared for Sunday. Martha Anderson. I don't think I see Martha either, but Martha's been a member. Josue Vasquez. Where you at? Oh, back there. The Josue and his partner in crime, Stephen Carey. And so we have a set of collaborators that we want to recognize, and I think they were mentioned earlier. Springfield Health and Human Services, Karen Health Center, Focus Springfield, Dana Farber, Harvard Center for Cancer Equity and Engagement. And then Karen didn't make it, did she? No, all right, so we were expecting a guest, but Karen didn't make it. Last but not least, we have this phenomenal panel, and we really need to give them another round of applause. And so, Archie, Darlene, Eduardo, Prarthna, Tashanna, thank you very much. And so, the good news, and I'm going to take a little bit of privilege here. The good news is Baystate made an investment in MOCA. How many years ago, Lamont?
It's been almost 14 years.
14 years ago. 14 years ago, I hired a grant writer by the name of Tony Moto, and Tony worked with folks at the Y to create MOCA, and it's been alive and well ever since. So, I mean, I am really impressed. Every time I show up and these men show up, you know, it is really feels good. And I have a great idea. Archie said it. We need to get, Dora, don't be making faces over there. This next conference, women, the partners of men, will hold a gathering about men's health. Can you imagine that? Where's your wife, Archie? Where's she? Yeah. She might actually lead that conference in terms of what she's done with you. So with that brainstorm, hold on to your seats. We might be doing something in a few months along those lines. But again, thank you very much, panelists. Guests, you've been tremendous blessing to be here to witness to this event. See you next year.
Thank you, Frank. And the call to action on the programs, that's okay. On your programs, there's a link. So please don't throw those away. It's a link to a Zoom meeting that will take place on Monday, May 8th, from 4 p.m. to 5:30. I'm hoping that our planning committee, our panelists, and all of you in the studio as well as online will be able to join us to debrief this as well as brainstorm about other types of activities that we can do, especially around supporting cancer survivors. Reverend McCullough, can you close us out in prayer, please, sir?
As we begin with a moment of silence for those who are not with us, I would ask that we hold a moment of silence to give thanksgiving for those who still are. And let us pray. Again, we give thanks and we give praise, Great Spirit. Thank you for moving amongst us, for inspiring us with what we have heard. Bless us as we go forth to continue to live, to continue to share, to continue to believe. And may we all come together and support one another on this journey of our lives. With thanks and praise, we say, Amen.
Please join us in the reception for some refreshments. Everyone is welcome. Thank you.